Hi everyone, this is your girl again, Bola Tofatoki at Spedeveryday. Today with me, I have, of course, on video call because of all the social distancing, I have Dr. Ayodeji Famuyide. Ayodeji Famuyide is a doctor of physical therapy and a fellow of the American Academy of Orthopedic Manipulative Therapy. He's also a doctor of clinical services and a COO, Chief Operating Officer of the Greater Baton Rouge Physical Therapy in Baton Rouge, Louisiana. He's been a physical therapist for over 30 years, meaning he has over 30 years of experience, and he's going to share knowledge with us today on how we can help our kids at home, especially, our focus here is on individuals with disabilities, our kids, and of course, because we know these kids do not have easy access to their therapists at this time, due to the lockdown, coronavirus, and whatever is going on in town today at this time, all over the world. So, as promised by special Spedeveryday, I said I'm going to be bringing in professionals that can encourage us and to talk to us and share with us all those things that even our doctors, we've heard from our therapists, our doctors before. So, hi, Dr. Ayodeji Famuyide. How are you doing today, sir?
Hello, good afternoon. How are you doing?
I'm doing great. Thank you. Thanks for being here with me today. This is so much appreciated. So I just want to, go straight into the interview. I know you're a very busy person. With my audience, I have different individuals with disabilities, and of course, physical therapy entails exercise and all that. And I have individuals on wheelchair. I have those with not on wheelchair. I just want you to share with me today, how is it important for them to continue with their care as related to physical therapy?
Well, thank you very much for that. I want to first say a big thank you to you for what you do and all you do. It's a good channel to get to your respectable audience and people that have benefited from your services. I really appreciate your time and what you do. Going back to your question that you asked me, I'm sure most of these clients have physical therapists or occupational therapists at their school before the break. And I'm sure that they have some home program that they're doing or they've been instructed to do. So I would first say that it's very important that they stick to or continue whatever their therapists have instructed them to do while they were in school. And as we speak, might be able to add one or two things to whatever they have. But the better thing for right now is that they have to stay with the plan of care established for them by their therapist, because that person has evaluated them, set up the things they need, and is very specific and tailored to their need. Thank you.
Thank you so much. So being parents, like we always talk about, each child has individual plans. Exactly what Doctor has said now about what your therapist has been doing with them. And I'm sure most of the caregivers are used to this as well. Also, I would like to ask, how much exercise can they do each day or each week? Because we don't know where this is going. And, some may not even remember what the doctor told them, but how much exercise do you think they can do daily or monthly, weekly?
Well, again, I'll go back to the set plan of care by their therapist. I am sure there will have been a set of frequency and duration. What I mean by that is this. They might say you exercise 3 days a week, maybe for about 10, 15 minutes on the hour, because everybody's need is different. If you're exercising to get endurance and some more coordination, we do long repetitive exercises, very low intensity for a short period of time, over maybe 30 to 40 minutes max, because of attention span and fatigue, and 3 to 4 times a week. But if you are doing exercises for strength or something that's more intense, you might do, again, 2 to 3 times a week for a lower distance of time, but it's high intensity bout. So again, there will be a plan of care established for them. I would just advise to stay with that plan of care at least 2 to 3 times a day. If you can do it every day, it would be great, but 2 to 3 times a day is often optimal, again, with the plan of care. Then the intensity has to be exactly what you're asked to do. I would just advise that you start slow and start light, and as you get more into it, if you've not been doing it before, then you can kind of get back to where you're asked to and just take it from there. And again, I'm sure that they will have access to their therapists when we are there over the phone to kind of update what's going on so they can make adjustment to those exercises at those times.
Thank you. Also having in mind with, you know, I know when people visit the therapies, they have like equipment that they can use and all that. But thinking about this and, you know, not being able to access those equipment at this time, what type of exercises should they be able to do at home, or can they do, you know, while we get over all this?
Well, exercises are generally divided into three main categories. We have some for stretching, for people that don't move much. In fact, all of us need stretches. Then we have some to strengthen, that means to get strength in the muscles on different part of the body. And there's some that we just do for what we call cardiovascular activity to increase heart rate, heart activity, lungs, and other vital organs. The plan of care that each and everyone has will have a cocktail of these three exercises together. So I would say you start with maybe stretches, then go back into do some cardio, then some strengthening exercises, then go back to stretching before you stop. Now, if a patient is wheelchair bound, you need a lot of stretches to the lower extremities and do a lot of strengthening and cardiovascular activities to the upper extremities, which is the arm and the trunk. Now, if someone is able to move around much more, then you can do a total of those three for different parts of the body. Again, I'm sure the plan of care will have addressed all these exercises in this different breakdown pathway that I've just mentioned.
Okay, thank you. I like how you're emphasizing on the plan of care, because this is really important for us parents or caregivers. We need to stick to the plan of care. Before you leave, I would also want to ask, is there any kind of exercise we need to avoid at home? You know, because I know there are things like, for me, I'm not used to like exercising or helping someone exercise, but is there like specific ones that we need to really, really avoid while being home now?
Well, with any exercise, safety is very important. You have to do it in a very safe environment. If a client is wheelchair bound, make sure that the wheelchair is locked or is hooked to an immovable part, so that when you start moving and do what you do, it doesn't move out on you. And if you're outside in an environment that is open, make sure it's safe, no sharp objects around, and make sure the environment is kind of protected. Then you don't want to do anything too strenuous. If you start causing pain, excessive fatigue, or discomfort in joints, that means it's too much. It's just good to back up from it. Then you don't want to do things that will kind of overstrain, overpush the system. Someone that is maybe diabetic in the process, you want to watch for the signs. If your blood sugar is low, and all those little things. So safety is very critical in whatever exercise we do. I want to avoid anything that will exacerbate injury, or cause harm in any way.
Thank you. Safety, caregivers. Safety is very important. So I know some of my audience, I know some of individuals with disabilities are on medication. All these exercises, even though they're sticking to plans and all that, do they do this before taking medication or after? How does it work?
Well, again, I'll keep going back to the plan of care. There is a medication regimen pattern that they were having during school year, and I would advise to stick to that, because routine is very important for everybody, including our clients and our patients too. So you already have an established routine and time you take the medication, and also the time you do the exercises during school hours. So if you can stay on that pathway, that would be best. But on the other hand, you don't want to take any medication that will make you tired or drowsy before you do an exercise. Definitely it's going to be counterproductive. And if you're having pain, you don't want to take your medication immediately before you do exercise, because it's not going to go into effect. You want to take it about an hour or two before you exercise, so that the effects can go in, bring down the pain before you exercise, so you can optimize the exercise that you are doing. So it's very critical to follow the plan of care, stay with your medication regimen, and just do your exercises and treatment as you were doing before the school sessions start.
Thank you so much, Dr. Famuyide. Again, I would say I appreciate you, interviewing with me today. And for my audience out there, I just want you to remember what he said. Stick to the plan of care. This is really, really important. And finally, before you leave, I would like to ask, I know this would also benefit the general population, not just individuals with special needs, especially in this season of we have to be at home and we're not able to walk around as usual and do a lot of things. Is there any general advice you can give to audience out there and everybody listening or watching this video on how they can use exercises to, better their lives and all that.
Thank you on that. The time now is very hard and difficult and scary. The infection going on is very tough. So we need to find a way to keep our mind sane and avoid fear. Exercise has been a very vital way of alleviating stress, depression, and improving our mind and ourselves. When we exercise, it kind of stimulates what we call serotonin in the system that makes us feel good. And it makes us feel better, whatever we're going through. So it's good to kind of get engaged in some form of exercise or the other. And when you start, you want to start slow, like I said before, and build up slowly. You want to start doing some stretches on different parts of the body, the arm, the leg. Then you want to do something like cardiovascular activity, like walking especially. You don't have to run or jog. Swimming, just walking 2 to 3 times a day, 15 to 20 minutes a day is very good. Then if you want to do some strength exercises where you do very low weights to get some strength in your body is also good. So something between 15 to 20 minutes a day, 3 to 4 times a week is great. But make it slow, make it simple, make it fun, because it's kind of stressful doing exercise if you don't have the habit before. So that is very critical. So I would say all that please, 2 to 3 times a day is fine. 15 to 20 minutes a day is good. Take it slow, be safe, and make it fun. Thank you.
Thank you so much. I appreciate all you've said. Again, audience, just to recap, safety is important. Stick to the plans you already have for your individual at home. And please, let's just keep being safe. Again, I know some of you might have heard this, from your therapist and other physicians before. This is just to reemphasize what you've been hearing and to know that we are all in this together, and we're going to do everything possible to help you relax, to self-care yourself as caregivers, and know that Spedeveryday is always here to answer your questions. If you have concerns, questions, or even feedback, just email me, spedeveryday@gmail.com. Thank you so much. Have a good day. Thank you, Dr. Famuyide. See you next time. Have a good day.
Thank you, Ms. Pataki, for having me. I appreciate it. Have a nice day.
Yeah, bye.
Bye.